If your knee still can't get straight after knee replacement, even after weeks or months of working at it, you know how frustrating this part of recovery can be. Fully straightening the knee is one of the top priorities after surgery, because falling short can lead to a limp, extra strain on your joints and muscles, and lasting mobility problems. Most people focus on stretching, which can definitely help, but what commonly gets missed is that this often isn't just a muscle tightness problem. It's also a muscle weakness problem. And on top of it all, issues with the back, the hip, and the ankle can also interfere with straightening the knee. It's all connected, and not taking the full picture into account can lead to long-term problems. So in this video, I'm covering the biggest issues that stop people from getting their knee replacement straight, and the most effective ways to treat each one. These are proven strategies, but since everyone is different, talk with your surgical team before trying these yourself. One of the main causes of a knee that won't straighten after surgery is quadriceps weakness. Your quadriceps is the large muscle on the front of your thigh, and it's the only muscle capable of straightening your knee. We call that movement knee extension, and no other muscle in the human body can do it. What's surprising is that even people who have very strong quadriceps before surgery can develop quadriceps weakness after surgery, and it has nothing to do with how hard you're trying. It's because surgery causes inflammation and swelling, and those things reduce our nerve's ability to activate the quadriceps and straighten the knee. This is called arthrogenic muscle inhibition, but you can think of it as the power switch to your quadriceps getting switched off. It causes the nerves that send electrical signals to the muscle to shut down, which means that the quadriceps loses its power supply. The reason our body does this is it detects surgery as an injury to the knee, and the muscles shut down to prevent movement and further damage. But this response in our body can have serious negative effects if it lingers, and difficulty straightening the knee is a perfect example of that. But what starts as a nerve and muscle problem doesn't just stay a nerve and muscle problem. A knee with weak quadriceps has a hard time moving into those last few degrees of extension, and over time, the soft tissues on the back of the knee lose their flexibility and scar into place. Those stiffened tissues don't stretch nearly as well, and they start physically stopping the knee from straightening all the way. In other words, the weakness problem quietly turns into a weakness and stiffness problem. Our joints, muscles, and bones actually follow a very simple concept. If you don't use it, you lose it. And if you don't use those last few degrees of extension, you lose it. So what do we actually do about it? The key to reversing muscle inhibition is exercise that activates the quadriceps again. One of the most important exercises is quadriceps sets, where you tighten your quadriceps muscle to press the back of your knee down into the bed or floor. As the muscle gets stronger, straight leg raises often come next, where you hold your knee straight with your quadriceps and lift your leg into the air. Leg extensions, especially with an elastic band, can help to strengthen the quadriceps even further. They don't look like much, but these exercises are so crucial that they're found in basically every single knee replacement rehab program. They help force the nerves to activate the quadriceps again, but sometimes the nerves are so shut down that exercise alone isn't enough to make them work again. That's where neuromuscular electrical stimulation, or NMES, comes into play. It's a device that sends electrical signals to your quadriceps muscle through electrodes that are placed on your skin. These signals mimic the electrical signals from nerves, which forces the muscle to contract. They also improve the ability of the nerves themselves to fire and activate the muscle again. You can think of it like jump-starting your muscles in the same way you would jump-start your car. NMES treatments are often provided by physical therapists, and studies show that they can significantly improve muscle weakness. Now, both NMES and exercise treat the effects of muscle inhibition, which are nerves that can't fire and a muscle that's gone weak. But the last treatment attacks it at the source, the inflammation and swelling that caused it in the first place. Cold therapy like ice packs or ice machines help reduce inflammation and swelling by temporarily narrowing blood vessels in that area, so less fluid and inflammatory cells build up there. And anti-inflammatory medications, like celecoxib and meloxicam, lower the inflammatory signals your body makes. Different surgeons have different icing protocols, and not all patients can take anti-inflammatory medications. So talk to your surgeon about what they recommend for you. Firing up the muscle, jump-starting it if you need to, and keeping the inflammation and swelling down give your quadriceps the best shot at pulling your knee straight again. These strategies tend to work best within the first few months after surgery, so starting early helps maximize your odds of reaching your extension goal. But as much as weakness matters, it's only part of the picture. Even with a strong quadriceps muscle that works the way it should, tightness in the soft tissues around the knee often gets in the way of full extension. The tissues that usually prevent the knee from straightening are at the back of the knee. The first is the knee's capsule, which is connective tissue that wraps around the entire joint. The next is the hamstrings, which are the muscles that run down the back of your thigh. And the last is the gastrocnemius, which is part of your calf muscle. The thing they all have in common is they cross the back of the knee joint, and that's exactly what lets them stop you from straightening your knee when they get tight. You can think of them like a chain lock on a door. The door starts to swing open, but the chain catches it and stops it from opening the rest of the way. A tight knee does the same thing. As the knee extends, those tissues in the back catch it and stop any further extension. One of the most common mistakes after knee replacement is spending too much time with the knee bent, and that lets those soft tissues behind the knee tighten up. If those tissues aren't frequently stretched out by extending the knee, they lose that ability to stretch, and the ability to extend the knee gets lost with it. And just like before, if you don't use it, you lose it. That's why we surgeons often recommend limiting how much time you spend with your knee bent. So how do we loosen that chain lock? The foundation is a stretch called heel props. You prop your heel on something like a folded towel or pillow with nothing under your knee, and gravity pulls your knee down toward full extension. This lets those tissues at the back of the knee stretch out and loosen up over time. The most common mistakes are putting the knee in a bent position with something underneath it and just not doing the stretch enough. There's no universal guideline for how much to do heel props every day, but many rehab protocols recommend doing multiple sessions daily and working up to 30 to 60 minutes per day. Under the guidance of your surgeon or physical therapist, adding weight with a weight cuff or even a bag hanging from your leg can help make the stretch even more effective. Now, heel props stretch out the capsule and the hamstrings, but they aren't very good at stretching the gastrocnemius. For that, the gastroc wall stretch is much more effective. This stretch involves stepping forward with your non-surgical leg and putting your hands on the wall for support, then bending the non-surgical knee while keeping the entire foot of the surgical leg on the ground. This should create a stretch in the calf of the surgical leg. The key is to keep the surgical knee straight, which ensures that the gastrocnemius is the main target of the stretch. But if stretching on your own isn't enough, there's a different stretching strategy that has shown real promise. It's called static progressive splinting, and it's basically a brace for your knee. What makes it special though is a knob that you turn, and this makes the brace gently push your knee into more of a stretch and hold it there. For some patients, this gives a stronger, more consistent stretch than they could ever manage on their own. Many protocols recommend using it a few times a day over the course of several weeks. Static progressive splinting isn't necessary for everyone, but it can be very effective when regular stretching alone isn't making progress. Now, for most people, the strategies of strengthening the knee and loosening the tightness are all that are needed to get a knee replacement straight. But the truth is that some people can have a well-performed surgery, do all of these things right, and still end up with a knee that won't straighten. There are a few reasons why this can happen, but sometimes the thing holding the knee back isn't coming from the knee at all. Your knee doesn't function completely on its own. It sits in the middle of a chain that runs from your lower back, down through your hip, and all the way to your ankle. And when one of those neighboring joints has a problem, it can quietly hold your knee back from straightening, no matter how much work you put into the knee itself. One of the biggest ways this happens is at the hip. Many people have a hip flexion contracture, which is where the hip settles into a bent position and loses its ability to fully straighten. If your hip can't get fully straight, it shifts your upper body forward and makes you more likely to fall. Your knee has to bend to bring your upper body back over your lower body and restore your balance. In other words, your knee is forced into a bent position to compensate for your hip's problem. You can develop a hip flexion contracture just from sitting a lot and not moving around much, which is common in people who've been dealing with a bad knee for a while. And that hip issue can interfere with your knee's extension without you even realizing it. But sometimes the trouble starts somewhere even higher than the hip, and that's in the low back. Just like the knee, the low back tends to wear out and develop arthritis over time. This is called lumbar spondylosis, and it often flattens out the normal curve in the low back. When that happens, it also shifts your upper body forward, and that pushes the knees into a bent position to restore balance and bring your head back upright. A problem that starts in the spine trickles all the way down to the knee. Even the foot and ankle can add to knee extension issues. A normal ankle lets the foot lift up toward the shin, but problems like tight calf muscles limit how high the foot can be raised. This means the leg has to find another way to transfer your weight forward when you're taking a step, and it often does this by keeping the knee bent. And you know the pattern by now. Keeping the knee bent all the time eventually makes it harder to straighten it. So what can you do about problems elsewhere in the body that are affecting the knee? Physical therapy for strengthening and flexibility can help, but since there are so many ways that different joints can affect the knee, there are so many different ways to treat them. If you think problems in other joints may be affecting your knee, it's worth bringing up with your surgeon. and possibly seeing a spine, hip, or foot and ankle specialist to get a thorough evaluation. Now, there's one thing about all of this that we haven't covered yet. Studies show that if a knee can't get within 5 degrees of fully straight, it leads to more fatigue and throws off walking patterns. But knees that can get within 5 degrees of straight generally have enough extension to function well. Patients often aim for fully straight, which is completely understandable. But most people can still have a very well-functioning knee, even if it's just a few degrees short. If you want more information on many of the exercises I mentioned earlier, here's my video on my top 8 exercises for restoring motion in the first 6 weeks after knee replacement. And I'll put another deep dive on knee replacement motion here as well. If you found this helpful, click the like button and subscribe for more knee replacement education. Stay well, and I'll see you in the next video.